Hello and welcome to our Friday webinar. We are back with Dr. Tom Tully on another episode of Ask the Vet. Welcome.
Well,
How are you?
hey, Laura, good to be back. Good to be back after kind of a little bit of time since our last one. So looking forward to the questions and seeing what everybody has, and we all again learn together. And it's going to be another, I know, great session here.
Absolutely. Yes, we always love these questions. Are always you never get bored. I mean, they're always really something you might not even have thought of before. So that's the fun part. I have a question that I never well, we have people to log on. So a couple days ago, my dog, there was a chicken nugget kind of food item on the floor, and he went for it. And you know how dogs, when they're trying to eat something quickly before you get to them, he kind of like grabbed it, it started to drop, so he grabbed it back in the air, tossed it back, and then he started choking. So I had to do like a Heimlich, like he literally was like, obstructed airway. So I did like a Heimlich maneuver, and it shot it out of him. So crisis averted. Never thought I'd be doing the Heimlich on my dog, but there I was doing the Heimlich on my dog.
It really works.
Of course, he went back to go eat it after he,
it would taste better.
Right. So I know birds are, they're built differently, so they don't have that same thing. But like choking in birds, is that something that you've seen, like, in kind of depress the heel bone? What do you do?
Well, it's a little bit different in birds because birds can choke. There's no doubt about it. They can get something in their mouth, and they can and it'll block their airway. Of course, disease can cause it to block the glottis. But one of the ones that I just never forget is that we had a cockatiel that was in our lab animal facility here, right near my office at the time. And it was kind of like the mascot cockatiel. And one of the administrative assistants had fed it a peanut butter and cheese cracker with the peanut butter on it. Well, the cockatiel started eating that cracker with the peanut butter on it, and the peanut butter got in the mouth, and it couldn't swallow and started choking on the peanut butter. Unfortunately, the problem with something like that is that a Heimlich maneuver works the best when something actually occludes the esophagus. So when you put the pressure on it, that it shoots out like a cannon, right? Like the chicken nugget. So with the cockatiel, you don't have that total occlusion, but you still have all of that goo in the beak. So a lot of times with birds, if they are choking, a Heimlich is not necessarily going to work. You can press down. Birds don't have a diaphragm, but there is pressure. They use their pectoral muscles, their abdominal muscles, and so they breathe like a bellows. So that gets the bird air in and out with all of the air sacs. So if you kind of press in on the lower keel, and then that's going to possibly get anything in the esophagus out, but you don't want to do it too hard. So it just doesn't work as well because you don't have that total occlusion. The glottis on a bird, they don't have an epiglottis. The glottis is at the base of the tongue. Many times you can see it at the very base of the tongue, and the tongue's very short in most parrots. And so I did intubate a chicken a few weeks ago, and some of the breeds of chickens, the glottis is way down in the neck, cervical area. It's quite unusual, but most of the time they're really close. And so the chances of, with something just kind of causing it and blocking it, like a piece of chicken nugget or something, is less likely, but they can get, something like peanut butter or something of that nature that can cause them to choke, and you'll have to open the beak to try to get it out. And with that little cockatiel, you can, like a Q-tip or something like that to try to get it out. And the little cockatiel survived, but I've always been leery ever since about feeding peanut butter, and I know a lot of people do. And said, well, doc, we've been doing it for 100 years and no problem. Yeah, that's good. And so but at the same time, this happened with this bird. So, but anyway, so there you go. So they can, but it's a little bit different in that aspect. It's more of a, if it's a gooey, something that's sticky, that they get caught in the mouth, that has to be kind of cleaned out more than using pressure to get it out. But great story, and I'm happy about your dog.
Oh yeah.
Did you give him the nugget after?
Oh, he went and retrieved it in the corner where he shot it out. So he wasn't going to give it up.
Well.
Yeah.
Well,
but he went a lot slower the second time around.
Yeah.
Small bites. Yeah. So, oh man. Well, that was actually really fun. I had no idea. I'm just imagining like mozzarella cheese would be something that you wouldn't want, like from a pizza, right? Gets in a bird.
Yes. Oh yeah. Something like that where they're not going to really chew, and so they're going to swallow, so that all kind of gets all stuck in their mouth. So you want to be careful with something like that. But if they do eat something, then they start choking, and they'll be flapping around in the cage, and so you'll know, because they'll be panicking. But then you have to open that beak and kind of clean it out, and you can save them if that does occur.
All right, there you go. So keep that in your back pocket for, hopefully you won't have to use that.
Hopefully you don't have to use it. No.
All right. So just let's see. So just to remind everybody, if you have a question for Dr. Tully, to use the Q&A button, not the chat feature, but the Q&A button, so we can capture it. And I do have a question out the gate for you. Are you ready for this?
Let's do it.
All right. Okay. So this is this is the 32-year-old Nande with lymphoma. Okay, it has now been over 8 months since Buster, 32-year-old Nande, was diagnosed with lymphoma. He's still doing well, still taking him to the vet once a week for an Onsior injection, which seems to be very efficient treatment. He's actually doing better now than he was a year ago. He's eating well and maintaining his weight. His feathers are in good condition. He's back to his regular cage, as not a hospital cage anymore. He really enjoys taking a bath in his fountain. He enjoys his weekly trips to the vet. Buster is still eating NutriBerries and Avocakes. I've come to the conclusion that he is intentionally dropping bits of both because he loves foraging on the floor of his cage. I think in part that may be because his balance is still not as good as it once was, but it seems fun for him. Don't know how long he'll continue to do this well. When he's initially diagnosed, both regular vet and veterinary pathologist at Angel Memorial in Boston did some research on lymphoma in birds, because apparently that's not very common. Their research found that the longest that any birds with a definitive diagnosis survived was 9 weeks, but those birds are being treated with some form of chemotherapy. Buster surpassed that some time now. We chose the Onsior because it is an effective anti-inflammatory without the side effects of the chemo drugs. It was the alternative to using prednisone as often as used with mammals, because prednisone, it has such a dramatic immunosuppressant effect in birds. So beginning to wonder if birds with lymphoma, like humans with Hodgkin's disease, can survive for a long time. And also they want to thank you for all the help you've given, Buster. It's made a difference. So there we go.
Well, I think, first of all, I think that the veterinarians that you've gone to, your veterinarian and yourself have to be commended on everything that you've done for Buster. I've, if anything, I've given moral support. And if that was helpful, then that's great, and I appreciate that. But no, the credit goes to your veterinarians and yourself, because this is a wonderful story. Although again, still has the disease, but is living, obviously, from what you're saying, a very happy and very productive life, having a good quality of life, which is excellent. As you know, what your, as far as your question, as far as the length of time, really, when we are treating any form of cancer, that it's somewhat unknown. We have an idea of what historically these patients have been able to respond to. But as we always say, each patient is different, just like you're different to your physician than anybody else they see. And how the bird responds, the species responds, the cancer response to treatment is going to be different. Over time, you get an idea on what the general information is on the cancer and how long the birds are able to live, but there's always the possibility that you're outside of the normal, and it appears that Buster, and then also with the treatment response, it could be again with the treatment, it could be beneficial. That that maybe others haven't, but so this is good news, and it's something for everybody to know that with treatment, we just don't know how long that they can live. Lymphoma, we've diagnosed it in chickens, in fact have it in a little bit more often than our citizen species, but we have diagnosed it in a number of different citizen species. And again, some of those patients that we've had haven't have lived about as long as you mentioned that the veterinarians, I think at Tufts had mentioned, but some have lived a little longer, but in general, not much. But Buster is continuing to go, so I would say keep on going. We had a little starling one time that had leukemia, and it was on chemotherapy for, I know, about 4 or 5 years, and had a great quality of life, and had significant leukemia. So it's not out of the question, but and you never know until you try the treatment. So that's a kind of a take-home message with this, and again, great work with your bird.
All right. Wow. Okay. So I have a fairly urgent question for you that just popped up. So they're saying that last night my blue front was choking on a clear, slimy, thick saliva, nothing solid in it, and that went on for an hour. And he's lethargic and not eating or drinking, but normally loves food and drink. We just went through a hurricane with much stress, so it's a stressed house right now. No power. The vet on call would not help. He had not eaten, so it wasn't food he was choking on, but more spewing of this liquid, the slimy saliva, I guess. So they're worried he wouldn't make it through the night. They're thinking maybe he has sauerkraut. And then it says, further to Amazon with sauerkraut, I don't want him to suffocate on it. Found a copy of an old webinar suggests nystatin, is that right? Nystaitin, and got a doctor script for that. He seems better and eating some your suggestion, what about antibiotics if this doesn't work? So.
Well, that is a very complex question there.
Yeah.
Well, I'm sorry about, and if anybody knows about hurricanes and living without power for weeks on end, it's me here in good old Louisiana. But I do feel, and for those that have been affected and are still being affected by the hurricane, it will get better, I can tell you, but it is difficult. One of the questions that I have is that with this is that the concern is the heat. It seems like this just all of a sudden started occurring, and the bird may be regurgitating. One of the things that occurs when you have sauerkraut is that it's like a where you have a brewery in the bird's crop. So it's going to kind of smell yeasty. The breath will have a smell to it. And so that's usually what is occurring if you have candidiasis, which is usually associated with a sour crop. And that's why they call it sour crop. It smells sour. Everybody who has a bird knows that it's wonderful. Their breath doesn't smell for the most part. If you have an abnormal smell in the bird's breath, that's usually an indication of a problem. I routinely smell the birds' breaths when they come in during a physical exam. It's just part of it that I'll have not get the beak too close to my nose, but nonetheless, it's something that is part of just the observation and assessment of the bird. But if they do have that sour smell, that's usually associated with that problem. We call it ingluvitis, which is a crop infection. That's usually associated with a bacteria that can include Candida. Normal Candida is usually a normal flora within the bird's gastrointestinal system at a very low level. But it can, if the bird has an infection where bacteria is involved, then it can predispose the bird to having an over growth of this Candida organism. Nystatin is the drug that is used to treat it, is the effective drug. It works by actual contact of the organism. That means that if you have nice yeast plaques in the mouth and you gavage the bird, well, that nystatin isn't going to work. They have thrush in humans, and they make mouthwashes where you actually rinse your mouth out with that, where it actually contacts the organism. So that's nystatin. But it's kind of like treating the yeast with sauerkraut with nystatin is kind of a secondary to if there's a bacterial infection. And so it would be really important to know if there is a bacterial infection and if it is in fact sauerkraut, because the bird could have just been regurgitating. It could have been hot. It could have been because the air conditioner isn't working. It's humid. You have a high heat index, within the house. And so this all could be it. And if you have birds that are within the house and there's no air conditioning, you have to remember birds will die. We've talked about it much quicker in heat than they will in the cold. They'll die like that. their normal body temperature will get up, it's normal about 105, 106, 107. It goes to about 109 or 10, they're dead. So you need to make sure that those birds are cool. And if they are being, if they're heat stressed and they're drinking water, then they may actually regurgitate. And so it could have mucus in there if they're dehydrated or getting dehydrated. And that may be what you're seeing. This regurgitation, if it's mucoid, if it's associated with dehydration, or something of that nature, then it's not going to smell. It will not smell. So that's kind of the difference between the sour crop and just a regurgitation of the mucoid material. If it is choking on it, like I said, this is where you'd have to kind of try to get that out of the beak if it is having difficulty breathing. Hopefully, in most cases, birds that will do this, they'll shake their head. I think everybody's been familiar with a bird that's regurgitating. When they're bobbing their head, they'll shake their head and they'll get the material out of their mouth. It's when and so in most cases they'll take care of it, but if not, if you see where they can't, then you'll have to kind of clean the mouth out like that. So that I just want to try to, because it's somewhat of a complicated question and we get those and I welcome those, but we have to go into a little bit of an explanation on that, because there's an environmental effect of heat. We need to talk about, we need to talk about that and understand that, what it can do to the bird: dehydration, overheating, they call it hyperthermia, as opposed to hypothermia, which is where you have low body temperature. And that can affect the bird, and it could drink a lot of water because it's hot, and then start getting the heat stress, and that comes up, and that's where you have the kind of the mucoid. And then you have the other aspect where it could be something within the crop itself, and there's a delineation between sour crop and what actually causes it, and nystatin and the bacteria. So hopefully that kind of tie.
Yeah, I think I got a little bit more of it. So they're saying no sour smell. The heat was okay. So just a clear and slimy, kind of like saliva, is what they were seeing.
Yeah. So my thoughts would be just to make sure that bird is maintained where it's cool, and that it doesn't get overheated without the electricity. And that's easier said than done. Been there, I know.
Yeah.
But whatever you can do, that maybe keep it out under not in the sun, but outside where there's a little bit of air movement at this time. And of course, if you have a generator, then you may have a fan or something like that you can place on it.
Okay.
But it doesn't sound like sour crop as it is. And if it's a one-time thing, it just may be just responding to all of the stress and the situation that's there. But if it continues, then it would need to be looked at.
Okay. And our next question is about a 2-year-old cockatiel. They say they heard a lot about the use of omega-3. I'm very confused on how much to do and what type, etc., to make it simple. Some have said to use actual omega pill and break it open and put it on something, but they don't have. They're wondering like how much and how often would you do that?
Yeah, and I don't have the information right there, and right off the top of my head, I cannot give any specific use this, because again, I think that's really unknown, and that is an excellent question, and it gets to a situation where you have supplementation and with supplements, and this goes for humans as well as animals. Many of these supplements that we have and that are recommended, and everybody knows that today the supplement's great, and then tomorrow there's this study on 5 million people that show that it does nothing. And so drink coffee, don't drink coffee, it's one of those things. And this is why this is such a good question. The omega-3s have been advocated to have benefits. I'm actually a supporter of of utilization of certain supplements, and with the benefits that are proposed for omega-3s that have not been actually scientifically validated in birds. I still say that if you can provide the supplement in a manner that is, I guess, acceptable, then I would say do it. And then, of course, the webinar, the person who asked the question is going, well, that's what I'm asking, Dr. Tully. What is acceptable? And so with omega-3s, I'd say if you have that's within a bird diet already, that's formulated from a reputable company, and Lafeber does have some, and I'm going to use Lafeber as an example, since this is their webinar, that they do have products with omega-3 in there. Is this the right amount? Is it perfect? Should there be more? Should there, and at this point, it doesn't appear that there's it's acceptable by the nutritionist that is with the company for birds. And so that's what I would say would be an omega-3 that would be where it would be something that I would have no problem with using. Now, just opening up omega-3 capsules and putting those in, we don't know how much the bird's eating. We don't know how much it is, how much it's actually beneficial. So that's why I wouldn't say just kind of go out and make your own recipe and do that. I would think at this time, with the information we have, the thing that I would recommend and what I use for my birds is products that are already that have been analyzed and assessed by a nutritionist that works for actually is a consultant with the commercial bird food companies or and products, and that's what I would go with.
Okay, yeah. So Brenda was mentioning that Dr. Susan Urroz was the one, she balanced the omega-3 and 6 and then the Lafeber diets. So
she
balanced. She worked on balancing the omega-3 and 6, omega-3 and omega-6 and then the Lafeber diets.
Well, there you go. So that's give credit where credit's due, right, Laura? And thank you. And Brenda mentioned that, so thank you. Yeah. So yeah. So that's. So I think that makes it easy for everyone at this time. We want to see more research that's done in this area to try to make sure that we get the most out of that supplement for the health of the birds.
Okay. So our next one is about a blue and gold macaw that can't close his left claw. So they want to know if you can talk a little bit about the structure of a macaw's foot and what might be the issue. So can't close the left claw.
Can't close the left claw. All right. Well, the first thing that I would say, well, the bird cannot close the left claw, and I'm thinking of the number of birds over the years, and also I had the the luxury of and the privilege of working on a number of wildlife cases that have had issues with closure of claw, and so if and also just leg injuries. The first thing that you would be that I would look at is to see if there's any abnormalities. Well, what's interesting about this question is it wasn't like, oh, we have this blue and gold macaw, and it got its leg caught in the bird cage and was trying to get away, and now it can't close the claw, or that we have this blue and gold macaw and it has a large swelling in the leg and it can't close the claw. So what this does is, it's like, I'm not sure about the age, but let's say it's an adult macaw, and that before that the bird was able to use the claw well, and then all of a sudden, boom, it just and it just happened. And so if it just happened on this adult macaw, then the one thing that you'd look at is that if the ankle functions, we call it the hop, functions well, the stifle functions well, and then only the foot does not, then it would be something that we would look at to see if there would be, what I would look at is, first of all, would do x-rays. Look at x-rays to see radiographs to see if there's any indication. X-rays can show soft tissue. It can show muscle, and there's not much muscle in those feet. And also you can look at the birds and all the way up into the body. And so if you look at that, then you can see if there's anything impinging on a nerve, or in that area. Also, so what you're looking at is if there's no swelling, no nothing that's affecting it there, then you have to think that you want to think about it. It can get where you have your ligaments and you have your nerves going down into that. And if you look at a bird's leg, it's not much there. Skin, bone, and you have ligaments, vessels, and nerves. And if anything impinges on that nerve and the function of that nerve, then it's going to, make it where you have an issue. So the one thing that you're looking at is to try to determine what it is. And if it's nothing obvious, then you have to go into, and this is what we do. We try to make a diagnosis, and this is a good thing for a lot of diseases. It's not like we just go and say, well, let's do these tests to figure it out. We have this issue, and then we go with the simplest test first to try to determine what it is. And if it isn't, if that doesn't come back, we have to go into more detailed tests. If you have an unusual issue, and this goes into the unusual issue, that's where you go and you look in to see if there is any and you say, well, what's causing it? Well, if it can't close it, then it has to, most likely be something associated with the nerves, or, a ligament issue that is affecting its ability to contract that foot. And if all toes are affected, then it's maybe nerves that affect that area. Now, you could go and try to make make a diagnosis, and I said radiographs, CT. You have 3-dimensional CT imaging, and if you go through and there is nothing there that you can determine, then what you're looking at is, you can say it's a neurologic issue. There's nothing that you can affect, or treat, and it could be due to a trauma. You could have had a traumatic case, and I can tell you that you have birds that you just don't see it happen, and you're not going to have swelling. The bird, it can actually it could affect the nerve, and then what happens is that the bird can't use the foot. So that's where the imaging comes in. It gets more detailed, and you'll be surprised what you can find. But in the end, if you don't, then in a case like this, then it could be trauma that you're not going to see. And then there's treatments that you can try to utilize to help with a neurologic issue. And then we have one is gabapentin that we've used, and that seems to have some benefit, but we really don't know exactly what all the benefits or what it can do. But that's these difficult cases where there's not a lot of information and it doesn't show up. That's how we look at treating those.
So I actually, sorry, I did it popped up some more information. It's a 32-year-old bird. It was all of a sudden, the leg seems fine. They want to know if maybe he could have broken a toe, because the vet suggested no x-ray. The foot is a little bit warm. The vet suggested laser treatment. Might be a soft tissue injury, perhaps. So. Yeah,
definitely. And that's, and again, your veterinarian is on that, and I'm just kind of giving a general overview on how we do it here on those, and that's all possible. But and we'll even go into a CT imaging is CAT scan. It works so well, we could 3-dimensionally recreate the foot, and we can look on all angles and look at joints. We can look at all of that, and that is especially for some of these difficult cases where you can see issues where the nerves and ligaments and everything go, and of course, but again, it sounds like you're being well taken care of. But when a lot of these times, Laura, when people ask questions, I'm going to give them our thoughts on these difficult cases and what we would do and how we would do it, one step at a time, going through to make sure that we know what's going on to make a diagnosis for a proper treatment.
Yeah, no, it's fascinating to get in your mind and see what pick your brain about what's going on there when you have a patient come in, right?
Yes.
Your starting point to get to the data. Okay. So then we have a question. Ooh, okay. So a middle-aged female cockatiel that's been diagnosed with hemangiosarcoma mass.
Yes, hemangiosarcoma. Yes.
It has been removed, and they want to know what are the chances that it'll return. And they also point out that the cockatiel survived being through the campfire a few years ago. So they're wondering if the breathing in all that smoke and toxins could have caused the mass. So will it return, and could have having all that smoke inhalation cause the mass? It's an interesting question.
Oh, yeah. I mean, that was terrible.
Yeah.
that fire. And I don't think that I'm gonna say the most problematic time during that fire, before or after, was breathing in that smoke and surviving that. I don't think that this is associated with it. I cannot guarantee it, but I would say that it is highly unlikely that this hemangiosarcoma is associated with that. But with that said, I think that the first question was it, is it likely to return? It just, to me, at this point, what I'm not sure. It depends on the size of the tumor. It depends on if there were clean borders, meaning that the tissue that was removed behind the tumor did not have any tumor cells, and also where the tumor was in that. But so it's and also the other issue is if this was the only hemangiosarcoma that was in the bird, if there was not another tumor someplace else. So all of those things have an effect on whether that bird, will have this reoccur or return. Clean borders, if this was the only one that was noted in the bird, and again where it was located in the bird. Yeah. So yeah.
Sorry, I'm just curious, is that something that would be caught on like what would any symptoms that would present with a bird that has a
if it's kind of again, you can have these sarcomas. I'm not sure exactly where. It can be internal. Hemangiosarcomas can be internal, or they could be under the skin.
This one was on the pineal gland.
The uropygial gland.
Maybe, well, they have it truncated as PINEAL, so pineal.
PIN.
EAL, pineal. Is that?
Well, again, I'm not sure what, if it's the uropygial, if it was at the base of the tail. Sometimes if it was the uropygial gland, then, or the preen gland is also called, then it's often difficult to, and that's at the top of the tail, base of the tail, dorsal side. It's hard to get clean borders on that. Usually those, and we have budgies, and usually in budgies, those glands, we get what we call squamous cell carcinomas, and have been treated successfully with strontium radiation therapy, and to give them a quality of life for a period of time, and they seem to have responded well. And to treat something like that, you say, I just talked to the oncologist about a bird budgie with that about a week ago, and so it's about a $360 radiation therapy for that tumor type. But if it was in the uropygial gland, preen gland, then it would be difficult to just surgically remove all of the tumor, and it would be difficult, not saying you couldn't, but I would think that it would give some time for the bird to have a good quality of life. How long, and if the tumor returns, then you may be able to provide some again resection, but it may progress into internal organs at that time. So yeah.
Okay. Okay, we have a question about Gloria took her Senegal to a new avian vet for a blood draw. The standard practice at the clinic is to anesthetize with inhalant gas to draw blood. This is the first time that they've seen this done. Is this protocol or something to be wary of? Is it something that vets do, avian vets do?
That's a good question. Maybe it's protocol in that clinic, and they may be very good veterinarians, avian veterinarians. I'm not sure. In general, I try not to anesthetize a bird to collect blood for diagnostic testing, and really try not to teach that that we don't. But again, it just depends on where the clinic, and what the clinic protocol is. Sometimes the veterinarians working there have no choice, but it's like, this is Rome, you do what and so, and it doesn't have anything in my mind to say if they're good or not good avian veterinarians. But I'll collect blood if we have a procedure where we need to say anesthetize or sedate the bird for diagnostic imaging or some other protocol or procedure. I'll wait until the bird's under anesthesia to collect blood. But if we're doing a physical exam on the bird, personally, I'm going to collect blood without anesthetizing the bird.
All right. Someone wants to know David wants to know how common is instant blindness in cockatiels. Their 20-year-old cockatiel went to sleep in his cage one night 2 months ago. The next morning, his right eye was closed. And he was at death's door. Turns out he got an infection by something in his cage, which nearly killed him. The avian vet treated the systemic infection, except for a permanent cataract in his right eye. They were kind of struck by the destructive speed of infections in cockatiels. So what are your thoughts on that? Just like an overnight infection, sounds like that.
Well, I mean, we've all heard of flesh-eating bacteria, and those are kind of overnight infections that'll kill a human fairly quickly. So we're susceptible as cockatiels. I would say after, working with birds for 35 years, that most of the infections that we almost all are no different than what's in humans. It's when we actually get, actually see them. Can you have an infection that occurs quickly? And as you described, yes, it can, even with the best of care and oversight. But I would say that that's somewhat the exception rather than the rule. Also, you can look at the hospitals, and I'd always try to kind of get everybody thinking on human when you're thinking about disease and medication. You have a 20-year-old cockatiel. Okay, what's the average life expectancy for a cockatiel? So I would say in general 15 years for a normal. Okay. And so if you say 15 years, well, we're at 20. And I'd say, well, I know somebody that had a 28-year-old cockatiel. We've seen those. We've seen some. Again, I always say, well, there's a 120-year-old lady in France that lived that long. But, That's we have 80-year-old is the life expectancy of a human here in the U.S. So the life expectancy. So what that means is that we put this 20-year-old cockatiel to kind of put it in perspective. Well, you have a very geriatric bird. And so the immune system is not what it was when it was a 10-year-old cockatiel, or for that matter, a 15-year-old cockatiel. So with the immune system not being as well as it is, or as robust as it once was, then it's more susceptible to these significant infections, and that occurs with older humans, and that's why they're so susceptible to infections, and so again, that is part of this. It was great that you were able to save the bird, and there could be consequences. There's also other health issues, cardiovascular disease. We've talked about that. The little bird could have had a stroke that was associated, not associated with this, that may have caused some of the blindness. And then also, as with other animals, as they get old, you're going to get lens opacities, cataracts. So it may be where you may not have noticed it before, but these have been developing, and I could almost say that it's not unusual for a 20-year-old cockatiel to have cataracts. The bottom line here is you've been doing a great job. I mean, this bird's in a wonderful home, and to have it at 20 years, just saw a little 22-year-old cockatiel just 2 days ago, and it was cancer, but nonetheless, that's great, and it was in a good home for its life, and so keep it up. The little cockatiel's still going, so even though it has a cataract, it'll do well. So that, yeah.
All right, and then Helene wants to know, what is a possible cause of a green feathers growing back in black after the molt? It's a 10-year-old kite. So 10-year-old kite, green feathers are growing in black after they molted.
Well, this is always an interesting question, and for the most part, I would say that if the bird is on a good diet, excuse me, if the bird is on a good diet and it is being well taken care of, that this is just somewhat of an anomaly, and this is also with the consideration that the bird gets a routine physical examination and has the complete blood count and the chemistry panel when it goes in, especially if they're seeing these discoloration of feathers, whether it's a different color or whether it's black, and so there could have a couple of things. It depends on, usually when these black feathers come in, they're kind of not all black, but they're black in certain areas. The feathers can be discolored, one, because they don't have the proper coloration within the feather, but also feathers have color due to the reflection of the light off of those feathers. So there could have been with the kike's feathers, as it will be on the body, or even the wing primary feathers. I'm not actually sure, but I think it's not necessarily the pigment, but maybe the light reflection that's causing the green coloration. So if you have some disruption of the if you have some disruption of the structure of the feather, that it's not going to have the light to give it the green. And then also it's always been mentioned that liver issues with black discoloration. So if you look on the internet and you go black feathers, they'll say liver. Well, I've really never seen where there's a correlation between the black coloration of the feathers and liver disease, but you'll read about it, but I've never really seen it. And nobody's really explained the pathophysiology. That means why it's the physiologic component, what's going on inside to cause this black coloration of feathers. But that's just been promoted since the early 80s, 1980s. And so when you look at this, I would say if the bird is otherwise normal, it's getting good nutrition, good environment, health-wise, and with the blood diagnostic test, there's no abnormalities, that this is just something with this molt that it's all likely that when it molts out again, it'll be fine. But if there's any problems in there that could be directly correlated to a disease process, then that could be investigated to see. But most of the time with these black feathers that I've seen in birds over the years, it's just kind of a transitory condition and on that.
Okay, let's see, we got a question about painkillers. They want to know, Diane wants to know what types of painkillers are available for parrots that actually work. Tim, the African gray, had surgery a year ago, and the longer term use painkiller did nothing for him. So now he's starting to get arthritis, and they're wondering if there's anything that would work well over the long term.
Well, is there any painkillers that will work in birds? Yes, there are painkillers that we see both that have been that there have been studies that have shown that they appear to have an effect, and drug and also pain medication, that there's therapeutic levels that are obtained by parrot species, and also a pain medication that appears to actually be effective clinically, meaning that, well, the bird is actually not using the leg, and then we put him on this medication and he uses the leg. Take him off, doesn't use the leg, put him on, uses the leg. So that's the clinical manifestation of treatment effect that we look for. So those are the three things. So that's good news for you. And so the classification of drugs, or the opioid drugs that have an effect that we use on the birds, but you're not going to be able to use those at the house. Not going to be prescribed for the bird, but we do have those for birds with surgery or patients that have surgery. And immediately prior or after surgery, we use to actually have an effect over and above anti-inflammatory effect, where that is effective in reducing pain. If you have, say, arthritis and inflammation, reduce the inflammation, reduce the pain. Well, there's no inflammation when you have trauma. And so you need the opioids. That's where that comes into effect. What you would be looking at is some of the maybe some of the anti-inflammatory, and we have used those with benefit. And meloxicam or Metacam is the drug that we most commonly use, can be orally administered and used as needed, because even with arthritic conditions, and hopefully, and similar to humans, that you would use it. I'm feeling some arthritis, and use it as needed, where you're not taking it every day. Well, I got to take my 2 Advil, twice a day. But you may, but most people would take it as needed. Well, I'm feeling better, I don't need to take it now. And so that's somewhat what we do with some of these older birds, and we're having more older birds that have arthritic conditions and that they do feel better. And from what we hear from the owners and from what we see clinically, seem to benefit from the medications such as meloxicam, which is an NSAID to use for anti-inflammatory treatment, such as arthritis. So there you go.
There we go. That's the one we're going to end on today, since we're out of time for more questions. So if you did have a question that didn't get answered today, we'll try to reach out via email and get that answered in. And then we will be back with you, Dr. Tully, in, gosh, October is just around the corner. We'll be back with you at the end of October, really close to Halloween. So
That's
maybe
scary.
we'll costumes.
That's scary.
Yeah. Is it scary? Well, this is going to do a whole thing on what scares your bird. About what scares your vet. How's that? What scares your vet when you bring your bird?
Yeah.
So I was going to announce we got a winner today of our giveaway. And that's going to be the Lafeber foraging pack, as well as another Lafeber product of your bird's choice. That is going to go out to Ron Lankford. So congratulations,
All right.
Ron. Hopefully you and your bird are like jazzed about that.
All right.
All right. And then also I'm going to give a sneak peek about our next. Oh, yeah. Someone wants to, yeah, Brenda wants to know what you're going to be this time for Halloween. So we'll just unveil it.
See, I don't know.
You can always be a vet, right?
Whatever it is, it's scary, you know.
All right. So wait, so yeah, October is, my goodness, it's like tomorrow, right? Wow. Okay. So
yes, it is.
So next Friday, October 7th, we're going to be on with Dr. Jorg Meyer. He is going to give us he's the University Vet Insider look. So he's going to kind of give a fun glimpse of what goes on at a veterinary teaching hospital. So there we go.
That ought to be fun. That ought to be,
yeah.
There
we go. He's at the University of Georgia College of Veterinary Medicine. Mm-hmm. So we'll get an insider look on what he does on a daily basis. So there we go. All right. On that note, I just want to say thank you once again for joining us. These are invaluable to people getting the best care of their birds.
Well, yeah. Thank you, Laura. Thank you, and all of the attendees. The attendees make this. I can tell you that the questions are fantastic, and we learn together. And I appreciate everything everybody does. Lafeber for putting this on, Brenda for her background support, and you for driving the ship.
Oh, you know, we haven't had in a while. We haven't had a stump the vet question for you in quite a while, where you had to look it up and get back to us. So let's see if someone.
Well, I mean, there was some things that, like the omega-3s today. I mean, and I can't go and actually find anything. And that was a great question. But like I said, so that was somewhat of a stump the vet. So, but we'll look for those, and those are out there. I can tell you.
That's right. Let's see, maybe your next, whoever's watching today, maybe your next question can be stump the vet.
Yeah, there you go.
All right. So hey, we're out of time, but I just want to thank everyone for joining us. All the best to you and your flock, and everyone stay safe, especially if you're in the path of Ian the hurricane. So hope everyone's doing well in those parts, especially. Until next time, everyone. Bye.
Bye. Thank you. Bye-bye.